All right, welcome back, guys. And today we're going to be talking about good old Tylenol, or as its more generic name is known as acetaminophen. It's kind of funny because I actually took this little line right here, pain reliever, fever reducer, actually off the bottle of Tylenol that I had here at the house when I was making the slide set. Some other names it's known as, obviously Tylenol, but APAP. So if you see codeine with APAP, that means it's just got acetaminophen with it, okay? And it's used to treat muscle spasm, menstrual cramps, toothaches, backaches, headache, fever. It works really good. It's an analgesic. It's an anti-inflammatory. Yes, actually, you can give this stuff IV. Oh, imagine that. Now, by the way, it's extremely expensive, especially compared to the by mouth form. Okay, so again, but you give it, you can give it IV, and it actually does some pretty good pain relieving effects. So again, it reducing the prostaglandin, which involves the pain and fever processes, and it inhibits the COX enzyme. I'm not even cyclooxygenase enzyme, and it blocks the formation of thromboxane A2, which it's platelet aggregates in arteries. It causes the arteries to constrict, so it actually blocks that. So it kind of increases blood flow, which is why it kind of helps in the analgesic effect usually. It does release mild to moderate pain by alleviating your body's overall pain threshold, and it lowers the fever to help the body to eliminate excess heat. And again, usually when we take it by mouth, it's about a 10-minute onset, and then the duration of action is usually somewhere around the 4 to 6 hour mark. And again, we use it as a pain reliever and fever reducer, and in the MI setting, it helps to prevent further clotting. So if it can be used sort of like an aspirin, but again, it doesn't work nearly as good as aspirin. So again, if you got the choice there, aspirin is the way to go. Again, dizziness, lethargy, hives, edema, lips, the tongue, throat, you can have that happen. They can get a little short of breath. Of course, nausea, vomiting is kind of a common one. Again, they can give you dark urine, and it can actually give clay-colored stools. And it can cause a little bit of jaundice because it does have it's processed in the liver, and it can cause liver damage, especially if you take a lot of it over a long period of time. Which kind of brings us to our why you don't give acetaminophen. If they know that they have an allergy to it, if they're a chronic alcoholic, probably due to liver damage, and then again, hepatic disease and kidney disease. And again, you want to use it in patients when they say that they're allergic to NSAIDs. Be careful, because it is sort of an NSAID, okay? It is a non-steroidal anti-inflammatory. So again, ethanol can increase the risk of liver damage when you take this. So don't go down, four Tylenol and then drink a 6-pack of beer. Probably not good on your old liver. Again, usually the maximum dose is 1 gram and in one sitting, and no more than 3 grams per day. That is a lot. Usually the tablets, guys, are the standard normal strength. They're like 200 milligrams. Okay. Again, we usually get they come in 325 tablets, 500s. That's what they usually come in. Matter of fact, most of them nowadays are usually the 200. But again, 200 or 500, you need to make sure you check the bottle of those. Okay. And this can be given via a suppository as well. Again, we usually give 500 milligrams, 5 to 600 milligrams is a normal dose of acetaminophen. And on your peds, actually, it says length-based tape. When I've given it to kids, I've actually looked on the box, okay? And usually done by the physician order, only if the physician says to do it. Again, your route is going to be by mouth or suppository. And once they get to the hospital, they do have the IV version. And the good news is, though, this is pretty safe for your patients that are pregnant. Usually when they have pain or problems when they're pregnant, they're told to take Tylenol. Because, again, it's a pretty safe drug for the pregnancy. All right, now Tylenol, again, is a pretty easy drug. So, again, make sure you study it up. Make sure that you take a good look at it. And I'll see you guys on the next one.